You may be asking yourself, so what is HIPAA? Well, the federal law known as HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. Congress passed this landmark law to provide the following: portability of insurance, protection and privacy of healthcare information, a standardization and efficiency in healthcare data, and prevention of discrimination and fraud. HIPAA gives the U.S. Department of Health and Human Services the responsibility of adopting rules to help individuals keep as much of their personal health information private as possible. HIPAA protects from unauthorized disclosure of any protected health information that pertains to the patient. It establishes a national set of security standards for protecting certain health information that is held or transferred in electronic form. In addition to privacy and security, administrative simplification provisions were also included in HIPAA to improve the efficiency and effectiveness of the healthcare system that required standardizing the electronic exchange of administration and financial data. And these include specific transaction standards and code sets, national standard unique identifiers for employers, health plans, and healthcare providers, and security and electronic signatures. HIPAA compliance is highly dependent on the size, function, administration, and type of the entity. Therefore, this training module is not intended to be a complete or comprehensive guide to HIPAA compliance. Rather, entities regulated by the privacy and security rules are obligated to comply with all of their applicable federal and state requirements and should not rely on this training alone as a source of legal information or advice. In addition, to ensure compliance with HIPAA, covered entities should regularly review their records to track access to protected health information, to detect security incidences, and periodically evaluate the effectiveness of security measures put in place, and regularly reevaluate potential risks of protected health information. Who's mandated to follow HIPAA requirements? Well, the HIPAA law applies directly to these groups, called covered entities. They're healthcare providers, health plans, and healthcare clearinghouses. So what's a healthcare provider? Well, it's any provider of medical or other health services, or any organization or person who transmits any health information in electronic form. And this includes organizations and individuals that provide bills or are paid in connection with services in the normal course of business. Some common examples include physicians, dentists, nurses, mental health providers, radiology centers, laboratories, pharmacies, durable medical equipment providers, hospitals, ambulance companies, home health care workers, and case managers and social workers. A health plan is any individual or group plan that provides or pays the cost of health care, such as an HMO, insurance company, Medicaid, or Medicare. A healthcare clearinghouse is a public or private entity that transforms healthcare transactions from one form to another into a required format. An example of this would be an outside billing service that ensures all information transferred between a doctor's office and an insurance company, and it complies with HIPAA. HIPAA applies to employers only to the extent that they somehow operate in one or more of these three groups. The same standards apply to covered entities in both the public and the private sectors. If a company offers health care and treatment to employees on site, such as an on-site clinic, the employer would be a covered entity and be required to follow HIPAA requirements.